Okay, so guys, this will be a recapitulation on your anatomy and physiology. So again, I would like to inform you that the session is recorded for future references. Okay. Now, class, since we're talking about anatomy and physiology, one important thing there that you need to remember is the definition of anatomy and physiology. Now, as a quick recap, when I say that I am studying the structure of the body, what is my focus? Is it the anatomy or physiology? When I talk about studying the structure of the body, what is my focus? Is it anatomy or physiology?
Anatomy, sir.
Anatomy, sir.
And if I say that I am studying the functioning of each of the organs of the body, what is my focus?
Physiology.
Diyan pumapasok ang tinatawag nating physiology. Okay? Now, if you would look at it later on, dear students, in the future, you will encounter the concept of, for example, if you will be learning already the advanced subjects in nursing, meron po tayong tinatawag na pathophysiology. Okay? Here is what we refer to as pathophysiology. So class, when I say pathophysiology, what we are trying to study there is the processes beside or behind your diseases. Kasi pag sinabi nating patho class, it talks about diseases. Okay? At saka pag sinabi nating physiology, it talks about the functioning of the human body, especially of the organs. So later on, pag tatanungin kayo ng teacher nyo, for example, what is the pathophysiology behind this disease process? Ibig sabihin, class, your teacher would want to understand what is abnormal. Okay, what is abnormal that is happening on the patient's physiology kung bakit po nagkakasakit yung pasyente natin. Okay, so yan po yung ibig sabihin ng pathophysiology. But just as a simple recall, for example, if I will count the number of the bones of the body, how many bones in the body ba do we have, dear students?
206.
Okay,
200.
pag sinabi ko na there are 206 bones in the body, what am I studying? Is it anatomy or physiology?
Anatomy.
Anatomy.
Okay, very good. No?
Anatomy.
Sinabi natin, binilang lang natin yung bones, no? Binilang lang natin yung bones. Hindi naman natin sinabi kung ano yung ginagawa ng bones. So we are just dealing with anatomy. Now, if I will say that the small intestine is actually divided into 3 sections, can anybody tell me what are the 3 sections of the small intestine? Can anybody tell me what are the 3 sections of your small intestine? You have your D, you have your J, you have your I. Yes. Ano po yung 3 sections ng small intestine natin? Okay? Yes. You can use the chat box. Or yes. Yes, Horteliano. Nicole. Okay. Wala pa? It's okay. Sige. Okay, very good. Somebody saying duodenum. Yes. Very good. How about the next section? Yes, it's jejunum. Naka-private message po pala siya. Okay, and then lastly, you have your ileum. Dear students, these are the 3 sections of your small intestine. Okay? Now, halimbawa, I'm teaching you, there are 3 sections of the small intestine. What are we studying? Is that anatomy or physiology?
Anatomy.
Okay, very good.
Anatomy.
Because we are studying anatomy. Because we are still talking about the structure. Kumbaga pa class, we are talking about how the organ looks like, where is the organ located. Okay, those are referred to anatomy. Now, if I will tell you, for example, that the absorption, okay, I will tell you the absorption of nutrients, okay, is taking place primarily in the ileum, okay, in the ileal segment of the small intestine. What am I talking about? Is this anatomy or physiology?
Physiology.
Or physiology.
Physiology.
This is already your physiology. Okay? Now, if I will tell you that bone resorption, okay, bone absorption and bone resorption, okay, regulates. It's the one that regulates the calcium levels in our body. What am I dealing with? Anatomy or physiology?
Physiology.
Your physiology. Okay, this will already be your physiology. Okay, but dear students, if you would look at it and come to realize it, we cannot actually study anatomy alone and then physiology alone. We need to study both of them. because they actually go hand in hand. If there will be problems in the structure of a certain organ, you would note that the functioning also of the same organ would be affected. Okay? So hindi po natin pwedeng sabihin na, o sige, anatomy na lang siguro yung pag-aaralan ko para magiging magaling akong nurse. Okay? Dapat class, you will be able to understand the physiology also behind the organ so that you will be able to know what's actually happening to your patients. Okay? Now, if you would look at it, ano nga ba yung emphasis natin guys sa nursing? So, di ba, if you will be asked, no, what is nursing? We always say that nursing is the science and art of caring. Okay? Di ba class sinasabi, no? Pag sinabi nating nursing, nursing is the science and art of caring. Sir, saan po papapasok yung anatomy and physiology? Bakit po kailangan ko po siyang matutunan in nursing? Class, when I talk about caring, one of the things that we advance in nursing is what we refer to as holistic caring. Okay? One of the things that we advance to is what we refer to as holistic caring, which means, class, that if I'm looking into an individual, if I'm looking into an individual patient, I could not look at him and then sabihin ko na, ay okay, itong taong to is equal to 2 arms plus 2 legs plus 1 head plus 1 torso. Hindi pwedeng ganun yung pag-define ko ng isang individual. When I talk about a certain individual, we understand that the individual is a physiological being with a psychological component, with a social component, with an emotional component, and then with a cognitive component. Ibig sabihin, class, when we talk about an individual being, we have a lot of components. Okay? So, di ba, hindi for example, pwede na titingnan ko si Nina tapos sabihin ko, okay, Nina, kamusta ka na? Okay? Nina, kamusta na yung paa mo? Paa lang ba yung mahalaga para kay Nina? Okay? So, when we are dealing with the patient, we look into them, into these different aspects. They are a combination of these different aspects. So saan papasok si anatomy? Class, the anatomy and physiology will make us understand the physical aspect of the human body. And how does it connect to the psychological, to the social, to the emotional, and to the cognitive aspect? Okay? So, kung kaya, kailangan nating ma-understand yung anatomy and physiology so that we will be able to effectively care for your patients. And mind you, my dear students, first-year student nurses, understanding of the anatomy and physiology could really make you, okay, understanding of the anatomy and physiology could make you an excellent nurse in the future. Okay? Pag naiintindihan nyo yung anatomy and physiology, guys, kaya nyong i-describe yung mga different diseases na pinagdadaanan ng pasyente natin. Okay, so I hope that you will be able to appreciate the subject. And once that you have the copy of your textbook, please read through the textbook. No? It will be an interesting material for sure. Okay, so that's it. No? My main point is, as a nurse, you need to understand the functioning of the individual in terms of anatomy and physiology. Okay, siguro bibigyan ko kayo ng example. Who can tell me, guys, what is mastectomy? Pag sinabi ko, class, na mastectomy, ano po yung kinukuha sa body natin? Mastectomy, my dear students, is a surgery. No? It's a surgical procedure. So what is being removed in the body? Can anybody tell me that?
Breast.
Okay, very good. No? So class, pag sinabi nating mastectomy, it's the removal of the breast tissue. So, okay, later on, you will know na pwedeng entire breast yung i-remove. Pwede na kasama yung muscles sa chest natin. Pwede na may mga kasamang lymph nodes. No? But if your patient, for example, would undergo mastectomy, what would be your major nursing consideration? Let's say, bigyan ko ng age group. Let's say, for example, that this patient is an adolescent. Ano po yung magiging major nursing consideration ko for this patient? Anybody? Sige na, palagay nyo. Isang pasyente, adolescent, mag-undergo ng mastectomy, ano po yung magiging major nursing consideration natin? Again? Kumbaga, guys, feeling nyo, ano kaya yung magiging concern? Ano kaya yung magiging concern ng patient natin after na ma-remove Okay, after ma-remove yung breast niya.
Ang outcome po.
Outcomes, yes. How about others? Tama yung idea. How about yung iba?
Appearance.
Appearance.
I think it concerns about her mental health, sir, since there can be insecurities
Tama.
due to
Insecurities, no?
the removal of her breast.
Magandang idea. Okay? So, class, tama yung mga sagot ninyo. Which goes back to the point that we are not just dealing na, di ba class, halimbawa, no, hindi naman tatanggalin yung boobs. We will not be removing the breast without any reason. So probably there is cancer, probably there is mass, probably there is a cyst, probably there is some underlying disease process. And then, if you are just a medical professional thinking na, okay, let's remove the breast, that will make the patient go better. Okay? Pag makukuha yung breast tissues niya, mawawala na yung cancer. That could be, pero tama yung mga concerns na nire-raise nyo. That's why, class, if you are dealing with an adolescent patient undergoing mastectomy, we have what we refer to as nursing diagnosis. The major nursing diagnosis for these patients is what we refer to as disturbed body image. Okay? So, tulad ng sinabi ng kaklase nyo, socialization, mental health. Okay? Paano kapag yung mga kaklase niya, their breast is already going big, however, theirs kasi flat because they have undergone mastectomy. Okay? Are they ready to explain it? So, as a nurse, when you are dealing with these patients, alam nyo kung ano yung intervention natin? We help these patients accept what they are going through. And how do we do that? No? How do we do that? We involve them, for example, in their care. For example, class, kapag nagde-dressing tayo, when I say dressing, when we are cleaning the wound of the patient, we would tell them na, ma'am, let's do it in front of the mirror so that you can observe. Okay? Ma'am, for today, since this is your first day after the surgery, I will be the one cleaning it. But tomorrow, I would want you to help me. Okay? So, kung nakikita nyo, class, baka isipin nyo, sir, pasyente siya. Why are we asking the patient to help us in cleaning the wound? Because, class, we are actually helping the patient accept that these are the changes that are occurring on her body. She needs to accept it. Okay? Nakukuha niyo yung punto ko, guys. Okay, that's how you care for your patients, no? So it's not just about, I saw somebody, somebody I think message na, we need to clean the wound. Tama naman siya, no? Sabi niya, promote wound healing and prevent infection. That is correct. Okay? And as a nurse, we also look beyond that. Okay? We need to care. Kasi class, isipin nyo adolescent. Di ba? That will be the time for puberty. Okay? Their worry is, ano na lang mangyayari sa katawan ko? Okay? Baka sabihin nila, bakit wala akong breast? Ano na lang sasabihin? May magkakagusto ba sa akin? You know, things like that. Okay, that sometimes, okay, with our culture, we are shy to talk about. And we need to deal with that as nurses to our patients. Okay, so again, I'm telling you that we are learning anatomy and physiology because we would want to imbibe on holistic nursing care when we are dealing with our patients. Now, if you would look at our body, they're actually different organs, no? And these organs would compose your different systems. And if you would look at it, each of them would have different functions. Now, allow me to have a quick recap on this. When I talk about hormones, what particular system of the body am I referring to? When I talk about hormones, what particular system am I referring to?
Endocrine.
Very good. So class, you have your endocrine system. Okay, you have your endocrine system. Now, if I talk about gametes, if I talk about the estrogen, if I talk about progesterone, if I talk about reproduction, what system of the body is in charge of this?
Reproductive system.
Reproductive.
Productive system.
Your reproductive system. If I talk about the excretion of waste products, if I talk about
Excretory.
sorry,
Digestive. System.
Okay, digestive system would be there. What else other than the digestive system?
Urinary system.
Respiratory system, sir.
Have your digestive system, you also have your urinary system. Now, for example, if I will talk about the balance of oxygen and carbon dioxide in our body, okay, what system is that?
Cardiovascular.
Okay, oxygen and carbon dioxide. Sorry, oxygen and carbon dioxide in our body.
Respiratory system.
Very good. Okay, so you're talking about your respiratory system. And then somebody earlier mentioned cardiovascular system. And I could not deny that is actually also correct, because their function are actually helping one another. What else? If I talk about the cognition, if I talk about the thinking process, what part of our system is that?
Nervous system, sir.
Okay, so
Central
cognition
nervous
is
system.
taken care
I
of
joke.
by your nervous system. Okay, nervous system. What else? If I'm talking about support, and structure, what system?
Skeletal system, sir.
Okay, so you have your skeletal system. Okay, or you have your musculoskeletal system. Now, class, if you would look at each of these system, take note that each of these system are not functioning independently. Okay, they are not functioning independently, but okay, they are actually interdependent to one another. They are actually interdependent to one another. Ibig sabihin, if there will be a problem in one of these systems, the other systems would also fail. Okay, if there is a problem in one of these systems, the other systems would also be affected. Okay, now let's give an example. If I would look at, for example, a patient with ulcer. Pag sinabi ko class ulcer, what part of the body yung affected? Again?
Stomach, sir.
System, sir.
Oh,
Digestive
kadalasan
system.
class, no? Pag sinabi nating ulcer, it is the stomach that is affected. So my dear students, there are actually two major types of ulcer. So you have your gastric ulcer, and then you also have your duodenal ulcer. Okay, those are the two main types of ulcer. Now, class, if you would look at your ulcer, one of the characteristics is that sino pong makakapagsabi sa akin kung ano yung nangyayari sa ulcer?
Magsakit po ang cancer, tapos magsuka-suka po ng
Acid is
Ito may mga hugot to.
hyperacidity, sir.
Okay, ito kasi mga nakaranas to siguro ng ulcer, no? Kaya nakaka-relate. Okay, so sumasakit daw yung tiyan. Pagkatapos, ano pa?
nagasuka po.
Acid,
sir.
Okay, nagsusuka daw. Tapos meron daw acid. Okay, tapos ano pa? Sige, susuka, masakit yung tiyan.
Or siya burning sensation sa tiyan.
May burning sensation daw sa tiyan. Okay? So, mga hugot, ano? Okay. Okay, mga acid reflux daw, mga ganun yung hugot nila. Okay, so class, later on, you will know that these are there are two main types of ulcer. Tama yung sagot ninyo, pero class, there are two main types, si gastric at saka si duodenal. Ang isang tip lang muna na ibibigay ko sa inyo is that gastric occurs, the pain occurs immediately after eating. For the duodenal class, the pain class would occur about 4 hours after eating. Okay? Sir, paano ko tatandaan yan? Class, isipin nyo na lang na yung pasyenteng gastric, siya yung payat. Okay? Yung pasyenteng duodenal class, siya yung mas healthy or siya yung medyo mataba. Isipin nyo na lang class, gastric ulcer, payat. Why? If your patient is having pain after eating, what's the tendency? Kakain ba sila class or iiwasang kumain?
Iiwasan.
Iiwasan nilang kumain. Kasi every time that they eat class, there will be pain. That's why the tendency is that a patient with gastric ulcer will not eat. And they become emaciated. In other words, class, kumukulang yung nutrients nila sa katawan nila. Okay? Now, to demonstrate what is actually happening in our organ systems, it's just like this class, no? If your patient class has ulcer, okay, sorry, hindi po ako magaling mag-drawing, pero I'm trying to show to you your gastrointestinal system. Okay, so when I talk about ulcers, dear students, what actually happened is that there is a problem on the lining of the stomach. Okay, there is a problem on the lining of the stomach. Now, question muna. When I talk about the stomach, is the stomach normally acidic or basic?
Acidic.
Acidic. Okay, si stomach po natin ay acidic. Okay,
Acidic
bakit
po.
siya nagiging acidic? Because it's part of its job, okay, to digest the food, it needs to have acid in it. It's part of its job that to digest the food, it needs to have acid in it. Now, since your stomach class is acidic, your stomach actually is protected by a special lining. May special lining po yung loob ng stomach natin, and that special lining in your stomach actually prevents the acid to damage your stomach. Okay? That lining, that mucosal lining, that's what we refer to as your mucosal lining in your stomach is actually the one that prevents the destruction of your stomach. Okay? Now, anong nangyayari sa ulcer? Hindi kasi kumakain. Always kasi kapag kumakain, spicy food. Always kasi nagso-soft drinks. Or baka kasi naninigarilyo ng grabe. Let's say for example, naninigarilyo, taking alcohol, those are all risk factors of ulcer. So ano pong nangyayari? Okay? Yung lining po ng stomach natin dahil sa paninigarilyo, dahil na rin po sa kakatake ng alcohol, sa kakatake ng spicy food, sa kakatake ng soda, nasisira po yung lining ng stomach natin. And because of that destruction of the lining of our stomach, there will be pain. Okay, there will be pain. It's because the acid in our stomach is also attacking itself. Okay, the acid that is produced by the stomach is actually attacking itself. Okay? So kung kaya, we have conditions such as your peptic ulcer disease. Now, anong nangyayari? Once plus your patient will not be able to eat, ano po yung mangyayari sa supply ng glucose sa katawan natin?
Yung ano po,
Decrease.
yung metabolism hindi makakapag-work, it cannot function normally.
Okay, tama, no? So class, the glucose will be decreased. Since nag-decrease po yung glucose natin, matuto po tayo ng medical terms. Yung medical term po dyan is hypoglycemia. Okay? Medical term po for that is hypoglycemia. Now, since bumaba yung glucose natin, tama yung sinabi ng kaklase natin that the metabolism will be affected. Okay? The metabolism will be affected. Affected in such a way na bababa din yung metabolism natin. Question. Pag mababa yung metabolism natin, will your heart be able to pump effectively?
No po.
No, sir.
Will your
Since
will your
glucose is important for energy and
tama?
health.
Okay. How about yung brain natin? Can you think properly if there is decreased glucose?
Kasi kulang po yung nutrients na
No, sir.
No, sir.
No, sir.
So,
No,
if you're
sir.
getting the point, class, hindi lang po stomach yung problema natin. Kapag sinabi nating peptic ulcer disease, pati yung hormones natin maaapektuhan. Pati yung reproductive tract natin maaapektuhan. Pati yung respiratory system natin, cardio, nervous system natin maaapektuhan. Lahat po sila naaapektuhan. Okay? It means class that everything in our body is actually connected. Okay? So that's why, okay, when you are caring for your patients, okay, let's say for example, ulcer yung sakit niya, do not just focus on the stomach of your patient. Okay? Because hindi lang po stomach yung problema natin. Okay? Now, allow me to give you an example para na later on, you will think also of patients, no, when you are studying your anatomy and physiology. Sorry na mute ko yung isa ha, may noise lang na konti. But anyway, so okay, let me think of a case, no. I could not give you the exact number, pero parang ganito. I had a patient once, 75, female. She came in with the hospital with somnolence. Okay? Ibig sabihin, class, ng somnolence, mahirap na siyang gisingin. Okay? Mahirap siyang gisingin. Okay? Lola, kahit ilang beses tawagin yung pangalan niya, mahirap po siyang gisingin. Okay? So, the family said that the patient actually had loss of consciousness daw. Sabi ng family member na walan daw ng malay. Natutulog lang daw whole day, natutulog lang whole day, pero hindi na daw magigising, nawalan daw ng malay. So the next questions that I asked was, kasi nawala ng malay eh. Sabi ko, was there trauma? So tinanong, natumba ba si Lola? Was there a time na nahulog ba si Lola? Was there a time that Lola had a fall? So wala naman daw. Okay. But plus, when we asked the family members, when was the last time that Lola was able to had meals? When was the last time that the patient had meals? Alam nyo, class, nagtiningan silang tatlo. Okay, nagtitigan silang tatlo. They look at each other and then nobody can give a fixed answer if when was their grandmother able to take meals last. Okay? So class, what happened? When we took the blood sugar of the patient, the blood sugar of the patient is at 40 milligram per deciliter. Okay? Hindi pa kayo nakaka-relate, ano? Normal value po nito, class, is 70 to 110 milligram per deciliter. So pag titingnan po natin, hypoglycemic po yung pasyente. Okay? The patient is already having hypoglycemia. But if you would look at the signs and symptoms, somnolence, loss of consciousness, parang una mong iisipin, hala, may problema siguro sa utak. Uy, hala, baka na-stroke yung pasyente. Kasi 'di ba pag loss of consciousness, kadalasan iniisip stroke, ano? 'Di ba? Tama ba? Kahit kayo hindi pa kayo nakapagtapos ng nursing, stroke na kagad yung iniisip nyo eh. Okay? Kasi basta ganun, sir, stroke kasi ang turo sa amin. Okay, so class, pag titingnan ninyo, what actually happened to that patient of mine was hypoglycemia. Okay? What we did was, okay, as part of the interventions, we give D50 to these patients. Okay, sir, ano yung D50? Plus yung letter D dyan stands for dextrose. And if you can recall your basic chemistry, dextrose is actually sugar. Dextrose is actually sugar. When we have given this through the blood vessels of the patient, nag-inject po tayo, nag-insert po tayo ng suero for that patient, the patient was actually able to recover. After 30 minutes class, the patient is already awake and then the patient class is able to respond to the questions. Which means that the major problem that the patient is having is actually hypoglycemia because of the lack of intake, the lack of food intake. Okay? So with that example, I hope that we're able to understand na, ay okay, kapag yung pasyente ko pala walang malay, napakaraming factors na kailangan kong i-consider. Okay? There are a lot of things that you need to think of. Okay? Hindi po lahat ng walang malay stroke. Ha? Hindi po lahat ng walang malay stroke. So in this example, in this case class, it's hypoglycemia, which caused the loss of consciousness. This also demonstrates how your systems are related to one another. Okay? That also demonstrates how your systems are related to one another. So I hope that you will be able to appreciate that. Now, we also have what we refer to as your feedback mechanism. Because class, this feedback mechanism, the main goal of your feedback mechanism is to what do you call this? Homeostasis. Is to maintain a state of balance which is referred to as homeostasis. May mali sa spelling ko. Okay, delete. Okay, so class, it's intended to maintain a state of balance that is referred to as homeostasis. So pag-isipin natin, pag sinabing homeostasis, yung keyword dapat sa Coco brain natin is balance and equilibrium. Okay? Balance and equilibrium. A question ha? Yes or no lang to. Pag sinabi kong calcium, does your body need calcium?
Yes.
Yes.
So if there is
Yes.
calcium in your
Yes.
body, what would you want? Gusto mo bang mataas yung calcium sa katawan mo or mababa?
Equal lang.
Balance.
The balance
Balance po.
lang.
Balance lang, sir.
Magaling na kayong sumagot, ha? Magaling na kayong sumagot. Okay? So class, tama yung sagot nyo, no? There should be only balance of your, okay? Balance of these nutrients in your body. And how do we take care of that balance? One important mechanism, class, that your body is doing is what we refer to as your negative feedback mechanism. Okay? Negative feedback mechanism. Ano pong ibig sabihin natin ng negative feedback mechanism? I'll give you an example. Class, for example, for today's video, if we will eat a lot, halimbawa, sir, gusto kong magmukbang, ilalagay ko sa TikTok, kakain ako ng marami. Kaya or ano mang gagawin mo dyan sa buhay, basta kumain ka, halimbawa, inspired ka, or halimbawa, malungkot ka, iniwan ka ng ex mo, Basta kumain ka, kaya marami kang kinain. Okay? Plus, once you eat a lot, your body would have received the signal that, uy, marami siyang kinain. Nag-i-increase yung glucose sa bloodstream. Mag-i-increase yung glucose sa bloodstream. Since nag-increase yung glucose mo, class, may gagawin si pancreas. What hormone do you think will be released by your pancreas? What
Pancreas gland.
Yes?
Pancreas gland po ba?
Oo. Ano? Yes, pancreatic gland. What would your pancreas release as a hormone? Hula lang. Sige. Discovers na the future lessons actually. Sige, class. Ano kayang i-release ni pancreas once na grabe yung kain mo? Kasi maraming glucose sa katawan. Okay, or let's go back to basic biology. What hormone of
Insulin,
our
sir.
body? Huh? What hormone
Insulin.
of our body uses or leads to the use of your glucose? Okay, may nakakuha na ng sagot. So that will be your insulin. Okay? So class, anong gagawin ni pancreas? Magre-release po siya ng insulin. Okay? Because class, your insulin is the hormone that facilitates the uptake of glucose. It facilitates glucose uptake. Yan po yung trabaho ng insulin natin. Nagfa-facilitate po siya ng glucose uptake. Now, kapag mataas na yung insulin natin, ano yung mangyayari sa blood sugar natin, guys? Anong mangyayari sa blood sugar natin? Tataas siya or bababa?
Tataas.
Ah, okay. Plus insulin. Ang purpose ng insulin is it helps on the uptake of sugar. So anong gagawin po class ng insulin? Kapag ito po yung mga cells sa katawan natin, okay, mga cells po yan ha, okay, i-label ko na lang para hindi tayo magkamali. So class, ano pong ginagawa ni insulin? Kapag nakita po ni insulin na ay may glucose sa labas ng cell, yung symbol po natin ng sugar is CHO, CHO, CHO. Okay? Pag nakita ni insulin may glucose sa labas ng cell, ang gagawin ni insulin, ipapasok si glucose sa loob ng cell. Sabihan, oy glucose, pasok ka doon kay cells because the cells need you. The food of our cells is your glucose. The energy source of our cells is your glucose. Without glucose, your cells would starve. Kaya it is the role of insulin to facilitate glucose uptake. In other words, it allows glucose to be used by the cell. It allows glucose to be used by the cell. That being said, ano yung mangyayari sa glucose dito sa labas ng cell? Would it increase or decrease?
Decrease.
Okay, very good. So class, with the increase of your insulin, one of the effect is that there will be a decrease of your blood glucose. There will be a decrease of your blood glucose. And kapag nasobrahan naman tayo ng decrease ng blood glucose, anong mangyayari? Class, your pancreas would release another hormone which is referred to as glucagon. Okay? At dahil class ng dyan si glucagon, magiging role na naman ni glucagon na ipa-increase yung blood glucose levels. Okay? And once class bababa yung glucose, if the pancreas is functioning correctly, what do you think would happen to the release of insulin? Would it continue to increase or would it decrease?
Decrease, sir.
I-decrease na siya. Okay? So class, if you would look at this now, ganito yung message ng negative feedback mechanism. Somebody is increased in the body, such as glucose. One hormone would help to decrease it. Once it's already decreased, another hormone would help to increase it. That's how your negative feedback mechanism works. Gets nyo, class? So yung ginagawa niya, dear students, is that it's trying to balance how our bodies work. It's trying to balance how our body functions. Okay? That is one example of your negative feedback mechanism. Later on, when you are learning the endocrine system, napakarami pong negative feedback mechanism in the endocrine system. Okay, there are a lot of negative feedback mechanisms under your endocrine system. So I hope that you are able to understand that. Okay? Guys, Are you getting the point?
Yes, sir.
Okay. So,
Yes,
bakit siya,
sir.
sir, naging negative feedback? Observe nyo lang yung mga araw-araw, nag-increase, may mag-i-increase, once sobrang taas na, i-decrease na naman, kaya yan, negative feedback. Okay? Now, ano namang example ng positive feedback sa katawan natin? Kasi in your handouts, it's talking about positive feedback. So, what happens in positive feedback? For example, students, no, when you will have your allergic reaction, okay? Halimbawa, sabihin natin you're allergic to the bee sting. Okay? Common example naman kasi is bee sting. Plus, your bee sting is actually very fatal, okay? Especially if allergic ka, it could lead to anaphylaxis. Anaphylaxis. Sir, ano po yung anaphylaxis? Anaphylaxis, my dear students, is what you refer to as severe allergic reaction. It's a severe allergic reaction, oftentimes described as life-threatening. Okay? Anong ginawa ni positive feedback? Plus, once your bee sting, okay, once your bee sting, for example, happened, okay, so class, may sting yan eh. Parang may poison yan na i-release. Halimbawa, na-sting ka dito. So, anong mangyayari? Your body would react. Your body would react by releasing a cascade of hormones, okay, and immune response.
Okay.
Okay, may hormones at saka may immune response. Bakit may hormones at saka may immune response? Kasi sabi ni body, uy, foreigner to. Bakit may ganyan to sa katawan ko? Ayaw ko niyan. That's a foreigner. Let's attack that foreigner. Okay? And what would happen? There will be an increase of your immunoglobulin E. There will be an increase of your eosinophils. And there will be an aggravated immune response. Palagay nyo, class, kapag allergic kayo, anong nangyayari? Nangangati tayo, di ba? Okay?
Yes.
You have itchiness. And then other than that, class, in this case of anaphylaxis, you could have difficulty of breathing. And that is because of the increase of inflammatory processes. That is because of the increase of inflammatory processes. Okay? In this case, my dear students, bakit siya naging positive feedback? Okay, it's positive feedback since once something entered your skin, there's a lot of increase that is happening in our body. Okay? Nag-increase po yung functioning, nag-increase yung immunoglobulin, nag-increase yung immune response natin. Parang yung katawan natin na shock. So, parang attack ng attack yung katawan natin. And during that attack, you have the increase of your inflammatory processes. Kung kaya, your patient is manifesting with itchiness. Kung kaya, your patient is manifesting with redness or swelling. Kung kaya, your patient is manifesting with difficulty of breathing because there is already swelling of the airways. Okay? So, ganun po yung nangyayari. That's positive feedback. Okay? Now, some of us would think, is inflammation, kadalasan, di ba, class, pag sinabi nating inflammation, we think inflammation is bad. Di ba? Inflammation is bad kasi sinasabi natin, uy, may bukol sa katawan. It's inflamed, masakit. Pag sinabi natin, uy, let's say for example, you were traumatized. Sinuntok ka dito. Ang tendency, di ba, class, mamumula ito kasi sinuntok ka nga eh. That is inflammation. Okay?
Yes.
Now, most of us associate inflammation to a negative process. But guys, if you would think of it, inflammation is actually our body's response to protect us. Inflammation is actually our body's response to protect us. Sir, bakit po nag-inflame? Bakit nag-inflame? Plus, that inflammation is actually intended by our body to remove the foreign organism, to remove the foreign body, to remove the foreign bacteria. Okay? Ayun nga lang, pag masosobrahan ka ng inflammation, magkakasakit ka rin. And that is where we come in as healthcare professionals. Okay? But main point here is that in positive feedback, once there's something that triggers the body, something would increase inside the body. In this example, there is an increase of allergen in your body, and what happened is that there are increase of hormones in your body also. Okay? So that's what happened to your positive feedback mechanism. Sir, saan po ba yung mas mabuti sa dalawa? Wala, class. They are both part of our functioning. They are both part of our functioning. So hindi ko po pwedeng sabihin na mas maganda yung negative feedback kaysa sa positive feedback and vice versa. Okay? That's not how we think of it.
Balance.
Okay, yes, very good. It is intended to maintain balance. Okay? Yes, ano daw yun, be? Okay? Sige, may sinesearch lang akong pictures for the next concept that I would want to emphasize. Mhm. So plus, another important thing that you need to remember, okay, in your anatomy and physiology is the description of the anatomical position. And when I say class anatomical position, this is how your anatomical position would look like. Okay, hanap tayo ng space. Plus, this is how your anatomical position would look like. Okay, so if you will be asked about the relationship of two organs in terms of anatomical position, yan po yan. Okay? Halimbawa, tatanungin kita, where can the scapula be found? Ano nga ba class yung scapula? Dear students, what is your scapula? Can anybody tell me what a scapula is? Again? It's your shoulder bone. It's your shoulder bone. Okay? So class, if I talk about the scapula, it's your shoulder bone. Okay? Like the one that you can see on my screen. So if I will ask you, where is it located? Is it located in the anterior aspect or the posterior aspect? Is it located in the anterior or posterior?
Posterior po, sir.
Posterior. Okay? Huwag niyo akong sagutin na, sir, depende kung anong part ng pasyente yung nakaharap. Sir, depende kung nakatagilid yung pasyente. Sir, depende kung yung likod niya yung nakikita ko. Wala pong kinalaman yon because this is the anatomical position. Okay? When I talk about the anatomical position, guys, okay, ayaw niyong lumabas. This is your anatomical position. Okay? That is how it looks like. Okay? Regardless of how your patient appears in front of you, this is the anatomical position. Now, common terms that you need to remember. If it is far from the center, is it proximal or distal?
Distal.
Okay? Pag malayo po siya, okay? Pag
Distal.
malayo po siya, if it's going away from a certain attachment, it's distal. Okay? Now, let's take an example. So, proximal distal. Nasaan na nga ba yun? Let's take an example. Let's say, for example, that the hand is blank the elbow. The hand is blank to the elbow. Is it proximal or distal?
Distal.
Very good. Okay. The hand clasp is distal to the elbow. Now, another example. The shoulder is blank to the elbow.
Proximal, sir.
Proximal.
Proximal. Okay. Proximal. Okay, so that's how we describe terms. No? That's how we describe terms in anatomy and physiology. Okay?
Proximal.
Yes, yes. Now, how about class if I will talk about away from the midline? Let's say, for example, away from the midline. Is it medial or
Lateral.
Lateral
away
po.
class in the
Lateral po,
midline?
sir.
So you would look at an imaginary line here. Okay, bakit hindi siya nagsi-straighten up? Okay, an imaginary line here. Okay, and then class, when it moves away from the body, it's referred to as lateral. Okay, now there's another term there that you need to remember: abduction and adduction. There's another term that you need to remember. So you have your abduction, and then you also have your adduction. Plus, ganito lang yung alalahanin niya. Pag movement towards the center, it's adduction. If it's away, it's abduction. Okay? Ganito lang, class. Pag towards, add. This is adduction. This is abduction. Okay? In other words, if I will instruct my patient, sige sir, we will do exercises. Okay? We will do adduction, abduction. This one, class, is abduction because I'm moving away from my body. This one is adduction. Okay? Sir, nagpapa-exercise po ba tayo sa pasyente? Oo guys, tawag po natin yan is range of motion exercises. Okay, so we have what we refer to as your range of motion exercises. You will encounter this when you will be learning the joints of your patient. Okay? Sige. Do you have any questions so far, my dear students?
And so far po. Wala,
Okay.
sir.
So class, what's going to happen is that I will leave you muna. You need to work on your student activity sheets and then you need to study your topics. I will be meeting you again at 3 p.m. today. Okay, I will be meeting you again at 3 p.m. today just to recap on some of the topics. Are we clear with that?
Yes,
Okay?
Yes,
Yes,
sir.
And then ganito class,
Yes.
pag may question, halimbawa, no? Pag may question, hindi maintindihan kung ano yung sinasabi ng SAS, lagyan mo ng question mark para mamaya, halimbawa, you can ask that question when we are having our class. Okay? Or pwede nyo namang isend sa GC natin yung question ninyo para mamaya, during our live discussion, I will be able to answer. And then, if you have, for example, Vinay, tawag natin yan class lang. Para mga pinasosyal na term lang po. Okay? So class, if you have Vinays, okay? If you have case Vinay, okay? Ibig sabihin class, pag may short story kayo ng mga nangyayari sa bahay ninyo, okay? Or na-notice ninyo sa kapamilya ninyong may sakit, you can ask questions about it during our class. Okay? Especially pag related siya sa topic natin. Okay? So pag may na-notice kayo, halimbawa, sir, bakit ba yung kakilala ko may ganito? Okay? Pwede po nating i-ask yun sa klase natin. As long as you don't need to mention the name and as long as you would not take my advice as a medical advice. Ha? Hindi po ako doktor. Okay? So you can ask questions related to that. Or for example, sir, may nakita akong ganito sa kakilala ko. Okay? Ano po ba to? Okay? If it's related siya sa topic natin, tingnan natin. Okay? Kasi class, it helps if we are connecting our topics to your real life experiences. And in this case, you don't really need to go to the hospital to understand anatomy and physiology. Okay? Anatomy and physiology is actually around you. Anatomy and physiology is actually you. Okay? Ikaw. Okay? Kaya nga sa board exam, anong sinasabi namin sa mga students? If you can't recall or if you can't answer the questions to the board exam, okay, the greatest tool that you have is yourself. Okay? So assess mo yung sarili mo. Okay? Ano kayang nangyayari dito? Ano kayang sakit dito? Okay? Baka dyan yung sagot. Na? So that's why you need to understand anatomy and physiology. Okay? So I'll see you again by 3 p.m. Please work on your SAS for both lecture and laboratory.